I want to thank CCIH for the invitation to be here, to Ray and to Gordon and to Laura and to Mona and so many others that have made this conference possible. I hope it's been a transformative one, and hopefully this session can kind of tie some things together, but also provide some real inspiration for the work that we're doing together to advance global health. It was mentioned in my bio that I am a minister. I did not preach this morning, thankfully, but that probably means that I might be a little anxious to preach. So I have a PowerPoint presentation, which usually helps discipline my speaking and prevents me from just going into preaching mode, but I can't promise that I will do that. But I really want to speak from the theme of faith-inspired advocacy for global health, which is very much tied into the DNA of what we've been discussing. As a Baptist preacher, I will admit that 15 or 20 minutes is like a warm-up. So I am going to try really hard to try to speak on the shorter side of eternity so that we can have a very interactive dialogue about such crucial issues that I believe are central to God's heart as well. So I also want to start with a little bit of my own personal story. And I want to start first with this image of Dr. King giving the I Have a Dream speech. And if you haven't had a chance yet, I highly recommend that you go and visit the Dr. King Memorial. It's only been open less than a year. It was dedicated back in November. It had been postponed because Hurricane Irene derailed the original plans. But I'm particularly proud because my fraternity, which is called Alpha Phi Alpha Fraternity Incorporated, helped birth the idea for the King Memorial, obviously then working with many others to help make it a reality. It took 20 plus years to happen. It was actually Strom Thurmond who signed the bill in Congress to initiate the actual search for a space. It's a fascinating history, and I don't have time to tell you the whole story. But if you have a chance to go see it, I was determined to go on the day that it was originally supposed to be dedicated. And there was torrential downpour and high winds in DC on that Saturday. But by Sunday, it was a perfect, beautiful sunny day. And obviously most people had decided not to come in because they'd canceled the official dedication. But I was there with my now 1.5-year-old son Joshua, looking at this incredible exhibit, this incredible memorial, first non-US president that has an official memorial on our mall. And there's what's called the Stone of Hope, where Dr. King is facing the reflecting pool, but behind him there's a backdrop of granite where there are 16 quotes by Dr. King that a group of scholars had to choose. And I don't envy that task, having to pick from the thousands of quotes that Dr. King gave. But there's one that I want to share with you because I think it really captures some of the vision that has to energize and to motivate our work in global health. So as Dr. King accepted the Nobel Peace Prize in 1964, he said this: "I have the audacity to believe that peoples everywhere can have 3 meals a day for their bodies, education and culture for their minds, and dignity, equality, and freedom for their spirits. I believe what self-centered men have torn down, other-centered men can build up." And in that quote, there is a vision for the kind of health equity that I believe we believe in, and I believe our faith calls us to help bring into reality. Dr. King, this quote really mirrors a vision that the prophet Isaiah cast in the 65th chapter of the book of Isaiah that I also want to share with you, where he says, "See, I will create a new heavens and a new earth. The former things will not be remembered, nor will they come to mind. But be glad and rejoice forever in what I will create, for I will create a new Jerusalem to be a delight and its people a joy. I will rejoice over Jerusalem and take delight in my people. The sound of weeping and of crying will be heard in it no more." Now, pay attention to this particular line. "Never again will there be in it an infant who lives but a few days, or an old man who does not live out his years. The one who dies at 100 will be thought a mere child. The one who fails to reach 100 will be considered accursed." Now, this is God's vision. This is God's dream. And I believe that we are called to be the instruments, the hands and feet of making that dream become possible, not in the everlasting, but in the here and now. This is certainly a dream that I think animates the work of World Vision. And sometimes I know that we have to believe in divine intervention to be able to support such a huge mission. Our mission is to ensure every single child can experience life in all its fullness. We seek to combat injustices facing children, working with communities. We have a very child-focused, community-centered model of transformational development that I'll talk a little bit more about later. But the reason that I wanted to start with this quote is I want to share a little bit about Joshua, and I'm a proud dad, so I am going to share with you an adorable picture. At least I'm biased. I think he's adorable. Picture of my son Joshua. The first picture on the left is literally the day he was born. And Joshua decided to come in the world in a pretty harrowing fashion. My wife was induced. She was 10 days beyond her delivery date. And we were fortunate that we knew that. We had been consulting a physician, and everything was set. Everything had gone smoothly in their initial period of labor. And the doctor convinced me to go get something to eat. This was about 5 in the afternoon because she was convinced Joshua wouldn't be born until the next morning. So I'm in the cafeteria, and I get this frantic call from a friend of ours that was in the delivery room, screaming at me, saying, "Where are you? You've got to get here right away." So I break into my best impression of Usain Bolt, and I'm sprinting down the hospital corridor, probably posing danger to anyone around me. I get in the hospital room, and it's been transformed in an ER episode with nurses and doctors swarming around my wife. They whisk her out, and all I know is that Joshua's heartbeat had started dropping precipitously. Didn't know much more than that. And I then was taken to the waiting room outside the emergency room, and it felt like an eternity as I prayed for the health of my wife and my child. The great news is that there was a skilled physician that was monitoring the heartbeat, got her into the emergency room in time, and was able to cut the umbilical cord, which was wrapped twice around Joshua's neck, strangling him, which is why his heart rate had dropped so fast. And he was perfectly fine. What I remember, though, as I was sitting there praying, is I felt God's presence and God's Spirit in that moment. And I really started thinking about the work that I do at World Vision, and literally how many children around the world are born into situations of inequity because they don't have access to all the things that we can easily take for granted. If Joshua had been born in probably 2/3 of the world, arguably, he probably would not have made it. And I chose the other picture because this is more recent. He's now about to turn 18 months. I've realized as a new parent, you measure time differently, usually in months and not years. But Joshua is within this very, very crucial but precarious 1,000-day window that you've probably been talking about during this conference, where life is so fragile, but it is so precious. The kind of care that a mother receives during pregnancy, from conception to delivery, and then the care and the nutrients and the nurturing that a child receives in those first 2 years of their life is absolutely crucial for their future. And yet we live and we tolerate a world in which those 1,000 days tend to be determinate for so many millions of children because they either don't make it to their 5th birthday, or they make it but they've been so malnutritioned or suffering from malnutrition that they become stunted, a condition that usually has consequences for life, physically and mentally. And so I believe that this vision that Isaiah offers and this quote by Dr. King is a direct confrontation with that reality. It is a way to say this does not have to be, particularly, and this is even the better news, when we have the science, the tools, the knowledge, the evidence base to counteract that, to transform that reality into one in which we believe God has called us to. And again, that's why your work is so crucial. But to do it, I believe there is an absolutely crucial role that advocacy plays. And I think we have to be a little bit honest with ourselves, particularly as Christian organizations and Christian leaders. This is where I want to show a little tough love, both even to my own organization, World Vision, but also to many of you. We have been very good at direct service delivery, at compassion, at helping to meet immediate needs. But I think we have not been as good, traditionally, in speaking, using our voice to address the systemic injustices that so often fuel the very outcomes that we just heard about. And I believe it's not a matter of either or, it's a matter of both and. But advocacy is an art form in some ways, it's a vocational call in other ways. But I actually believe that in your organizations, all of you need to be more of an advocate. World Vision has 44,000 staff around the world. It blows my mind when I think about how large that footprint is. And part of our goal, part of what we're working on, is to try to make each and every one of those staff an advocate in some way. That doesn't mean they become a full-time advocate. It doesn't have to be the majority of their job description. But if they can use their voice and influence to address some of the systemic injustices that are driving health inequities, I believe that we would have much more influence. And my prayer, my hope for you is that you would be able to do the same. I just want to give you a sense of how we define advocacy at World Vision. It is a project, program, or programmatic approach that seeks to address the structural and systemic causes of poverty by changing policies, systems, practices, and attitudes that perpetuate inequality and that deny justice and human rights. A lot in that, but I think the most important piece of this is that it is dealing with policies, systems, practices, and attitudes that perpetuate inequality and that deny justice and human rights. Again, we need the best evidence-based programs possible, but so often those programs don't always address some of the systemic challenges. World Vision has embraced a pretty ambitious and bold vision that by 2016, we will have directly improved the well-being of 150 million children around the world. This vision is only possible if we ramp up our advocacy. Because even if we doubled the size of our programs around the world, we certainly have 1,600 what we call area development programs that work in 97 countries. So we have quite a bit of reach. But even with that reach, we would not be able to improve the well-being of 150 million children without addressing, again, some of these policy and systemic issues. So part of what has created a hurdle for Christians and for the church in addressing systemic change is we've been stuck with some false choices. And I have two pictures here. It's a little hard to see, but on the one hand, you have Jesus blessing someone's feet, and you could argue this could be many examples in the Gospels where he is healing someone who has some kind of infirmity. And on the right, you have Jesus entering the temple and overturning the tables of the money changers because he's angry that they're defiling the temple with commerce and exploiting the people. And so you have these kind of two juxtaposed images of Jesus. And again, we don't have to choose one or the other, but we should try to piece a more holistic understanding of who our Savior was and follow both. It's not about service or activism. It's about trying to find the connection between them. It's not about charity versus justice. It's about meeting immediate needs and addressing some of the underlying root causes of people's needs. There's a passage in Isaiah, which I don't have time to read, but in Isaiah 58, there's this really beautiful, holy description of the connection between justice and charity, where the prophet talks about what kind of fasting God wants from us and says that when we feed the hungry and when we break the yokes of injustice, then our light will shine like a noonday, and we will become called as repairers of the breach and restorers with streets with dwellings. It's a beautiful passage, but I'm mentioning it because it ties justice and charity together, and that's where they belong. Well, I think as faith-based organizations, Christian leaders, first and foremost, we got to start from our faith. Advocacy doesn't need to be something that we add on. It's not an extracurricular activity. This is integral to who we are and integral to discipleship. The two words for righteousness and justice in Greek and Hebrew are mishpat and tzedek. Mishpat is basically translated as to govern, to rule, and tzedek is righteousness, although sometimes as Americans we've privatized our notion of righteousness. And when the Bible has a much more communal understanding of righteousness, it's about how things ought to be around us and within us, but also around us. Well, these two words show up 1,000 times, over 1,000 times in the Old Testament, and are a pervasive theme across the entire Old Testament and then going in the New Testament. Certainly God's character and nature are crucial for understanding a commitment to justice and systemic change. God hears the cries of the oppressed, including those in Egypt that were crying out, and obviously Moses was empowered by God to be the one that got in the way of Pharaoh's repressive rule.